Hi, everyone. This is Dr. Michael Hirsh, your host for another edition of Health Matters, the cable access TV show for the Worcester District Medical Society in cooperation with WCCA TV. And very happy to have a special guest today who will be explaining a little bit about what's happening with public health post-pandemic, and it's very nice to be able to say post-pandemic. Mr. Soloe Dennis, who became the director of the Department of Public Health. It's been 6 months now.
6 months now.
Yeah.
6 months now, Dr. Hirsh. Thank you so much.
It's wonderful to have you, and I really appreciate you giving us your time. You're such a busy person. We weathered the storm of the pandemic, and I think the Department of Public Health deserves a lot of accolades for how we helped get the city through some tough times. But, there we had a very clear mission, and what was revealed when we were doing all of this was how much of the city was suffering from health disparities and people that had poor access to care, poor living conditions, some of the things that would promulgate outbreaks and problems in the future. And now we hand this all over to you and ask you to help us move forward and potentially both prevent future outbreaks, but also to deal with these revelations that we saw. So I'm saying belatedly, welcome to Worcester. Thank you for taking the job on. It's not an easy job. But the nice thing about it is for you, this is almost like coming home. So tell us a little bit about how you made your journey back home, Mr. Dennis.
Well, thank you so much for that warm introduction, Dr. Hirsh. So my career started at the State Department of Public Health. Working in the city of Northampton, I was the regional director working for all 75 municipalities in Western Massachusetts. Prior to that, I used to work for the Pioneer Valley Planning Commission. I was a public health preparedness planner. And prior to that, I used to work for the city of Springfield as the public health deputy commissioner. So when this job opened in Worcester, coming from Worcester and finding this opportunity, working for the city of Worcester, being Worcester is one of the first accredited health department in Massachusetts, it definitely was an opportunity for me to come back home. And at the division, we're doing a lot of great work around advancing and just promoting public health in general. So it's a blessing and to come back home and to work with you and the staff in the division to advance and to address some of the social determinant of health and the health equity challenge that we face. So thank you.
Well, thank you. I think we were very, very lucky that you were available at the time that we had our vacancy at the top position, and you've, I think, stepped in very seamlessly. And what has impressed me so much, if I can call you Soloe, and
yes, Soloe, please, Soloe,
one of the
yes,
folks,
yes,
is that you listen before you speak.
Yep.
And I think that's a very important. We try to teach that to our medical students and our graduate nursing students. That sometimes it's what you don't say that's more important than what you do say. That you have to kind of hear the patient out, and I think you really were feeling out the city, trying to get the feel for the relationships between the different divisions in our Health and Human Services Department, and also where we sat in the overall scheme of city government. And everywhere that you have been, the reviews are stellar. That you have great insight, but my old chief of surgery used to say, you may be the smartest guy in the room, but you don't make everybody else feel dumb.
Well,
So I think that's a very good trait to have.
well, I would say this, Dr. Hirsch. It's been a joy for the last 6 months working in the division. When you think about public health encompasses a lot. Public health encompasses environmental health, nursing, um, looking at the air quality, but also the social determinant of health, looking at transportation, looking at child maternal health, looking at and other issues. So, working in the division, you have great professionals that understand the work, understand the community, and we all about saving lives and looking for solutions to better everyone's lives in um, the city. One thing about the division that I'm very proud of is we are not Worcester centric. We part of the Central Mass this Central Mass Health Alliance that consists of West Boylston, Shrewsbury, and the town of Grafton. While working in that shared health process, we get to advance public health at a very high level, looking at uh, how folks interact with the health department if there's requests for resources, but also to serve as convener when it comes to looking at addressing critical challenges in the community.
And I think you mentioned that we did get our formal accreditation in 2016, and we're in the process now. It was delayed a little bit by the pandemic of trying to reaccredit ourselves.
Yep.
And there's a lot that we have to be proud of in that period of time since 2016. I think we've become a much deeper department with a better breadth of understanding of not just the needs of Worcester, but like you mentioned, the towns. And we're also in the process of regenerating a new community health improvement plan. But the first step in doing that is chartering a new community health assessment. So
Yes.
we call that the CHA, and then the community health improvement plan is called the CHIP. So maybe you could explain to our viewers a little bit about that process and what we're doing to kind of make sure that it's very thorough and inclusive and encompasses a lot of the different constituencies that we're serving.
Yes, being the lead agency in this process, the community health assessment process, it's a process where we take a high-level landscape of the health status of the community. We have partners like Fallon, UMass, and the Greater Worcester Healthy Group that is leading that process. And through that process, we convene meetings with a lot of stakeholders in the community to get the input in terms of what are some of the health status and how can we collect data to actually identify that. From there, we can develop action plans to see how can we address some of the challenges that we are facing. And through that process, collecting data, surveys, community input is very important to this process. That's where we generate input from the community and our stakeholders in terms of what are some of the health challenges and how can this partnership help elevate those challenges, but identify resources that could be brought to the table to address those challenges.
Yeah, I think that's really critical, and it's great that you've continued to support that concept, which we initiated in our first version of CHIP, which was way back in 2013. It wasn't enough for us just to have the statistics of what brought patients into the hospitals in central Massachusetts or what caused them to die in central Massachusetts. That's important statistical information, but the subjective information that you get from town meetings and surveys and focus groups and the different kind of coalitions that we have where we can listen to the people themselves, I think really helps to inform better. And you mentioned, for example, transportation. So if we have a situation where we have the greatest hospitals in the world, and we like to think that we're very blessed in Worcester with two really good health institutions in UMass Medical and St. Vincent's Hospital, but if people can't really get to the care that they need, then it's not really functional for them. I think the other thing we learned in the pandemic is that we have a lot of backtracking and explaining to do about what health care is about, because we've left a lot of the populations behind. They're distrustful. They're not as informed as they need to be. I think they're sometimes scared of the information, and sometimes they're just not hearing it from the right messengers. So what do you feel is the best approach for us there to help them move along with the rest of the community?
Well, I think one of the there's a lot of challenges, but I think there's a lot of solution as well to looking at it from a public health perspective. One thing we're trying to address on that, Dr. Hirsh, is building a more robust community engagement group. In a division, we have an office of community health, and through that office, we have a grant that was funded by the REACH. And so the REACH grant is about addressing health equity, inequities in the Latinx population. And so through that funding mechanism, we were able to develop a trusted messenger event where we have engaged up to 300 partners, faith-based organization. And through those partnerships, we have been able to engage them to talk about trust, right? Community trust is both ways. I think, as you indicated during your opening remarks, that you got to be a good listener, right? So our role is to go out in the community through our community trusted partner, just listen. I think one thing COVID has shown us is there was a lot of misinformation, a lot of mistrust. I think from the division perspective, we wanted to build a more robust engagement with our organizations, but also the residents. These are the most vulnerable population, and so building those relationships, one, we can better understand the challenge, we can better align resources, but also we can have a more effective public health program to address some of the challenges.
Yeah, so I think that is a really great philosophy and approach. I wanted to talk to you about two things while we still have you, and one is the relationship of the Division of Public Health with the Board of Health. Now, you weren't here when this happened, but I think you've been in other models of this. We originally had a model where there was an all-powerful Commissioner of Health here in Worcester, and just by the stroke of a pen, that person could ban sugary drinks or decide what the age of tobacco smoking should be or whatever. When I took over that role as the medical director back in 2012, I felt that was too much power in one place. So I took over as the acting commissioner, but we went to visit several different townships, and Cambridge had a model that we really thought we should embrace, and that was the commissioner became the medical director, advised the Worcester Board of Health. Instead of the Worcester Board of Health advising the commissioner, it was the other way around. The key thing was that the Board of Health members had to be, very savvy in their own expertise. And we happen to have a terrific board now. And now that you've taken over, I think your interaction with the board, just observing, 5 months of meetings, has been really, really positive, and I think they're 100% on board with, our agenda. How has that relationship developed for you, and how do you see it in the future?
Well, I think the relationship is great. the board play a very critical role in terms of looking at policies, looking at programs that the division should invest the time and energy in. I think my relationship with the board and the chair has been excellent. The board is very supportive of the work that we doing in the division currently. I think looking forward, this relationship will foster in terms of looking at what are some of the areas that we need seek guidance from the board around workforce development, looking at some of the challenges and some of the health areas that we need to invest our time and energy in, what we need to do around smoking, what can we do around some of the nuances around a lot of those vaping products that's in schools today, right? Just making sure that we have information when they need it, and how those information is relayed to them, and how can we be part of those discussion and part of those policy planning, part of the work from planning in terms of addressing some of the health challenge.
Yeah, I think you handle those meetings really smoothly, and I don't think we ever leave there feeling like we haven't done our job in informing the
Yep.
board, so they can make good decisions about whether it's tobacco or we were even talking about fluoridation issues.
Yes.
I know that's been a third rail here in Worcester for many years, but whether we advance any policy there, I don't know, but at least it won't be from lack of information,
Correct. Yes.
which I think is great. And the other thing I really have admired, Solo, in you is that you're very, very committed to the notion that the Division of Public Health can be kind of a educational lab for the right students. And, we're blessed in Worcester with 11 institutions of higher learning that all have service learning requirements, community service requirements, and some are professionally interested in aspects of public health and in some of the sanitation work that we do out in the townships. And so you really have tried to rekindle that relationship with the Higher Education Council of Central Massachusetts, HECMA, because it was still a very vibrant relationship we had, but it was all centered around making sure that those college students were vaccinated
Yep.
and safe, and that we were containing any outbreaks that they were experiencing. But the actual work of educating them, or potentially seeing our location as a place where they could do internships and do practicums, that all went by the wayside. Now you're moving that forward again. Tell me a little bit about that.
Well, I will say this, Dr. Hirsch. During my tenure at UMass, I got my first internship from the Worcester Division of Public Health. That's a while back ago, right?
Mm-hmm.
And I'm a big believer in workforce development. As the pandemic have shown us that you need a variety of talents, folks to actually do work. And public health encompasses a lot. You need data, you need environmental health, you need a risk communication expert. So as you indicated, Worcester is very rich with great academic institutions, and I think in the next century we need competent workforce, and I believe in this kind of partnership, right? The university have unique skills in terms of research. We will definitely enhance those partnerships by working on a grant program to be a lab where incoming public health practitioner can come and learn the skills in order for us to hire them, in order for us to be successful and they to be successful at work in the workforce. So workforce development is very critical. I believe in that 110%. I think it's important that we have available partnership with our university partners. We make available spaces for interns to come and learn. We also look at how can we grow the workforce, right? And so the workforce development and those partnership with the academic group is very important as we look to a prevent the next pandemic and also look at some of the mechanisms for us to be successful in applying for grant, but also looking at other resources that we could leverage.
Yeah, the certainly in the accreditation process, they look very favorably at our track record of having had people like you that were actual interns
Yep.
and our shop working at our shop. That was true for Zach, our recent deputy director of health, and also for our deputy director, Colleen Boland, before him, was also an intern with us. And so now we learned that you were an intern in those days, and that's a great track record for us to be a place where people can learn and grow, and then, like you, potentially, come back and, and help us with your tremendous skill set. So I know that, predicting the future is a very difficult thing. I'm going to reveal this about you, Soloe. Soloe was a Yankee fan. As much as we love him, he has a flaw. That's his flaw. And so Yogi Berra, one of the more famous Yankees, he's got a whole bunch of sayings. He said, it's very difficult to predict the future. It's very hard to make predictions, especially about the future.
Yes.
So I'm going to put you on the spot and have a crystal ball here for you.
Yep.
A lot of people ask, do you think another pandemic is coming down the pike? And what do you think is the biggest overarching health challenge that has remained relatively unaddressed?
Well, to your first question, I think, there's a possibility. But I will say to that, the more prepared workforce we have, the better chances we have to address and find solutions and mitigate the next pandemic, right? It all comes to workforce development. It all comes to community engagement, the community being more resilient, more having accessibility to resources in order for them to be able to take care of their friends and family, right? To your next question, I think at the end of the day, it's all about, I believe, the process of we have to be just aware of everything, right? And so from a public health lens and looking at that, I just feel that we just have to be, we need the right data, right? We need the right information to make the best judgment as public health practitioner to save lives.
Well, it's a powerful statement, and I think Yogi would be happy with that prediction. So
Thank you.
Thank you. Yeah, we're really blessed that City Manager Batista was able to lure you back. I guess you are old friends with Mr. Batista.
Yes, we former UMass alum.
Yes.
Yes.
That's great. That's great. Well, we got you now. Springfield's lost, Northampton's lost, and we're very grateful that you were willing to come back and share your wisdom and your experience, and the gentle hand that you've used in taking over a department that was really very tired, exhausted from the fight. And you've done a beautiful job. I know it's going to only get better. And our audience is, I think, very lucky to get to meet you at this young stage. You will be here much longer than I will be, but in the years that I have left as medical director, it's really a pleasure to work with you.
Well, I will say this, Dr. Hirsh. Thanks for your leadership. Thanks for your work. And I'm very blessed to be working in the city of Worcester and my three community as well. So it's an honor and privilege to be in Worcester.
That's wonderful to hear. So, folks, this is why I love doing these hosting jobs for the Worcester District Medical Society and WCCA TV. We meet such great people. Here in the second largest city in Worcester, we have somebody with a heart that's big enough to deal with all of us. So thanks very much for listening. Come back and see us again. We do this a couple of times a month, and thanks to all the folks here at WCCA TV for making it so easy. Have a wonderful summer, and I'll see you soon. Thank you.
Thanks, Dr. Hirsh.